Yes, we know that Homabay County has confirmed several cases of cholera. Um, as Migori, we know Homabay is our neighbor, and we do a lot of cross-traveling and everything. So we are aware and we are on high alert. The county government has put in place several measures to make sure that cholera doesn't enter Migori. Because as it is right now, we don't have any cholera case in Migori County. We don't have any suspected case in Migori County. And this is because of the measures that we are taken in place. We've alerted all our health facilities to be on alert. We've shared the case definition for the disease. We have alerted our community health workers through our community health services structure to make sure to be on the lookout and conduct what we call community surveillance to identify if at all there is any case and report immediately. But apart from that, we have instituted what we call preventive measures in the entire county. One of them is water treatment, what we call household water treatment, because we know that we are experiencing a short drought and most probably our river waters are contaminated, especially at the rural areas. So we've been conducting sensitization on water treatment. We know that our latrine coverage in Migori is quite okay. So we are emphasizing on use of latrine at the household level, hand washing at the household level, and we are also giving the community members of the household the signs and symptoms of cholera, so that in the event we have such kind of signs, they are able to give us the alert. We are working with other departments, like the Department of Water, the Office of the President, that is the Ngao. We are working very closely with the Provincial Administration to make sure that the entire community observes all hygiene and sanitation prevention measures. In the towns, in the urban centers, we are now emphasizing on our public health officers to conduct what we call sanitary inspection in hotels and in eating places and even in other premises that are handling food or storing food. Inspections just to make sure that food handling is at its best at this particular time. All the food handlers, we are advising and we are making sure that they are tested through the routine ways and they are certified to be handling foods. And we are also informing our other stakeholders, that is the hotel industry and other industries, just to be on the lookout and to make sure that the contractors, in the event there is actually an issue that is there, in the event that people don't adhere to the rules, we have the other legal ways which we're going to institute. But as it is right now, we are not having any cholera because people are observing the measures, and we'll continue enforcing them until that's time when we'll make sure that Migorians are safe and they're able to go about their business and they're not infected in any way. Yeah, the last time cholera hit us was in around 2016. After that, a lot of things were put in place because according to World Bank, we were spending almost 800 million on treatment. That is basically money which was being lost because of sanitation-related illnesses. But right now, through the community-led total sanitation, we've been able to increase the latrine coverage to almost 95%, and we are really insisting on sustaining that 95%. And maybe that is one of the gains that we're getting, because if it was less, then cholera would have been in Migori. But because of the improved sanitation facilities and services that we have, the risk of contracting cholera has actually been reduced. And we are now getting into what we call market-based sanitation, whereby we are now encouraging communities to invest in construction of better latrines, which are going to last and which are going to provide free smell, free flies, free of smell, so that apart from preventing the open defecation, we're also preventing flies and smell from getting into the households. and in one way or the other creating some sort of discomfort. So that investment through partners and the county government has enabled us really to suppress the emergence of diseases. As I've told you, cholera was reported back in 2014-2015, and because of the interventions, up to this moment we've not reported. And we want to strengthen that so that we don't report any cholera case, even as at now. Generally, the diarrheal diseases have gone down. We used to have typhoid cases, but right now they have actually gone down. It is a burden, yes, but it is not a big burden like the way it was some 5-10 years ago. Yes. Long-term investment, we need to have a sewerage system, and I think that is something which is under plan. But as a short-term measure, we are now investing in what we call sludge management. That is the effluent that is coming from the households and going into the septic tanks. We are finding ways of how that is exhausted and taken to the treatment facilities that we have in Migori and maybe out of Migori. So right now, we are encouraging households first is to invest on septic tanks, that is in the urban areas, so that their waste is able to be managed comfortably. And then number two, I've just said that we have public health officers who are now on the ground. They are moving around. First, sensitizing the community because it is part of the market-based sanitation. We are trying to talk to the communities to invest in sludge management, especially in the urban areas, so that we reduce the leakages. But in the event we have leakages which are interfering with the comfort of the community, we have the law which we are actually enforcing so that we make sure that people comply.